upon completion of medical school, that is the final year, there's a list that is usually made by the board of examiners to certify that a given group of students, a given number, has passed.
Yes.
And are now qualified to proceed for internship. So the list is forwarded to KMPDC.
Okay.
And within 30 days, they're supposed to organize how to allocate internship centers, and the process has to be fair.
Welcome to the One Health Lens podcast, where we talk about matters health, global health, public health, and the road to you.
UHC today. Don't forget the road to UHC.
Road to UHC. I'm your host, Dr. Diana Wangari Gitao.
And I am Dr. Simon Moshara Kigodu.
Today we have a very important conversation. It always is, but we have, I think, what we'd say a conversation about the future of healthcare, and perhaps a conversation also about the history of healthcare in Kenya. I think recently we've seen a lot of conversation around doctors are about to go on strike, doctors have not been posted, interns have not been posted. And we've had questions around who are interns, who are doctors, why are doctors striking year in, year out, right? And I've actually had someone ask, why are doctors special? So today we have in studio with us Joseph Akumu, an unposted intern. And what is an unposted intern exactly? Joseph, karibu.
Oh, thank you for inviting me to the show.
You're welcome.
Yeah.
Who are you?
I am Joseph Akumu.
Yeah.
A unposted medical intern.
Uh-huh.
I graduated from the University of Nairobi last year.
Yes.
And this is what we are going through.
Okay, so unposted medical intern. Okay, let's start from the beginning. You joined medical school 6-7 years ago, is it?
I joined in 2016. That's 8 years ago.
8 years ago.
Yes.
Okay.
So,
okay. Okay, you joined first. In fact, even before that, you went. Where were you born? Let's start from there. Where were you born?
I was born in Asumbi, Homa Bay County.
Okay.
And I went to AIC Bethel Primary School.
Okay.
Excelled. I was in the papers.
One of those. Okay. Uh-huh.
And then, of course, I went to Maseno School.
Yes.
Again, I excelled and was in the papers. And
again,
in the University of Nairobi.
Primary, secondary, then University of Nairobi.
Yes.
Okay. And this means you were sponsored by the government to pursue medicine.
Yes.
Okay. So you joined medical school.
Yes. And in the course of the 8 years, we also had challenges. There was COVID, there was the doctor strike, there was the lecturer strike. So instead of the stipulated 6 years, I ended up spending 8 years.
8 years of medical school. At some point, did you think maybe I should just give up and go to another course? Even before you graduate?
Yeah, especially post COVID, because we stayed at home for around 14 months.
Oh, yeah.
So there was a lot of frustration. And then that is the time when most of my peers were completing school.
I can imagine 4 years. The rest, most people you have graduated secondary school, high school with have done 3 years, 4 years. They are done by then.
Yeah.
Okay. So, and also, I'm assuming because of the nature of training, virtual was an option, but it's not, you don't complete practice because you're not seeing patients, right? Hence the 14 months, is that it?
Yes.
Okay, fine. Okay, so you're done 8 years later.
Yes, 8 years later.
What does your mom say?
And now to new travels.
In fact, the classmates you're with in high school, they have probably done even a master's, haven't they?
Yeah.
They have children, families.
Some have families.
And here you are with us. I tell you. And you graduated July 2023, University of Nairobi.
I completed school in July,
Okay.
but the graduation was in December.
Okay, fine.
Yeah.
So what typically happens, you would graduate, and then what happens from there? You've graduated as a medical graduate, right? MBCHB.
Yes.
Yeah. What typically happens for you then to go to internship? Is there a procedure? Do you fill out forms? What happens?
Actually, you don't need to wait for graduation.
Okay.
Upon completion of medical school, that is the final year, there's a list that is usually made by the board of examiners to certify that a given group of students, a given number, has passed.
Yes.
And are now qualified to proceed for internship. So the list is forwarded to KMPDC.
Okay.
And within 30 days, they're supposed to organize how to allocate internship centers, and the process has to be fair. And then after that, within 30 days, they're supposed to forward the list of the medical interns from across the country and the internship centers that they are going to the Ministry of Health.
Yeah.
And then immediately after that, we are supposed to report to our internship centers within 30 days.
Within 30 days.
Yes.
Okay. And essentially, there is a list within the medical board of internship centers, right?
Yes.
So the students who've graduated from medical school across Kenya essentially are matched to that list of internship centers. Is that it?
Yes.
Right? Yeah. Do students select? What would happen?
Yes, there's an option of selecting, but what they're doing now is called like you spinning the wheel. It's like a lottery, so you can land anywhere within Kenya.
Okay. So then July 2023, 30 days have gone by, 2 months have gone by, 3 months have gone by, right? You have not been posted, right? Yeah. What, at that point in time, what's the communication you're receiving?
So the balloting was done in November, and
Okay.
the list forwarded to the Ministry of Health. The initial excuse by the Ministry of Health was that we wait for the January group to complete their internship. And then January came.
Okay. This is the previous year interns.
Yes.
So they should finish so that you can enter the centers. Okay.
Yeah.
Okay.
And then when January came, the excuse underwent an involution, and it became then there are inadequate funds. Okay. And then from that, we moved to we're training too many doctors. And then it moved to doctors are unaffordable. Oh. And then recently, I even had a very outrageous one that we don't have consultants to train us in the internship centers.
I mean, how many medical interns are there currently unposted? How many are they?
Around 1,300.
1,300. Yeah. Okay, let's take a step back. When you joined medical school, how many students were in your class? Year one of medical school, how many students?
In year one of medical school in UN, we were around 450.
450. And this is a combination of both government-sponsored and self-sponsored students, right? Okay, 450. By the time you're graduating that same class, how many were you?
We were around 270.
So around 50% or 45 to 50% dropped out in the course of the 8 years now.
Yeah, it's not easy.
It's not easy. It is not. Tell us, what's that? What does it take? You come from Homa Bay, right? Yeah. I'm sure your parents took you to school. Yes. You have siblings. Did they contribute to your education at all?
I am a beneficiary of black tax.
Okay. Yes. And what do you mean by black tax?
Good line.
Yes.
So,
good line.
Yeah.
My fee, the contribution was done by my parents and my elder siblings.
Yes.
And they're all teachers. Yeah.
Okay. So everyone chipped in.
Yeah, everyone chipped in.
And so everything was on you. We have supported you. You must perform, right? So you go to Maseno, you perform, right? And you say to yourself, you want to become a doctor. Why do you want to become a doctor by then?
The main reason was...
and also because, remember, they've contributed. You know it's going to be at least 6 years, right? Before you can start recouping the cost of you going to school. Yeah. Why medicine?
Part of the reason, like growing up, I would say I had never met a doctor. Like I had never been treated by a doctor. It was mostly by maybe clinical officers or maybe some small clinic in the village or around where we stay. So I really wanted that access, so people can have that. And then again, I passed, and most people
said yes, absolutely.
My parents wanted me to be doctor.
Absolutely.
Doctor.
So truly for you weren't going to medicine, and like maybe at some point in our time it was that you want to become a doctor to make money. For you it was the fact that you are looking at your community. You wanted to be the first doctor, not just in your family, but potentially to even set up something back at home where there's actually a doctor for the first time. Right? This is what took you to medical school. Okay. You're finished. It's been almost now going to 1 year, 9 months or so. You have not been employed at all. And you know that you have graduated. You still have to do internship to get your practicing license, because you cannot practice without that having gone internship and then getting your practicing license. Is that true, right?
That's true. If you practice without the license, the fine is 5 million shillings. Or a jail term of 5 years, or you can receive both.
Okay. So you cannot even there, right? Because the investment, you've had 8 years of school, you're now about to take that down the drain, right? Okay. So it's been this period, you have not been posted. What have you been doing before you even go back to medicine? Because it cannot be between July and we're now in March, right? You have just been at home. I'm assuming you did not go back to Homa Bay. School was in Nairobi, right? So what have you been doing in this period?
So when I completed school last year, I had to take a break at least. I went to Homa Bay.
Yes.
So I did some farming. That was until around September. So farming was hard, and then people talk so much in the village.
Daktari Merudi.
You meet the picky guys, and they tell you, even these degrees don't really matter.
Even these degrees really don't matter.
So staying at home was a bit of a problem. So I decided to come back to Nairobi. So in Nairobi, I've been doing online writing, academic writing or article writing.
Finya computer to $1. Sorry, carry on.
It's not really the tough tengele one.
Yes.
And the job, I would say it's boring. It's not what I went to school for.
It's not the passion. It's not.
Because I think you'd also you need to enjoy your job.
I think so. I think so. And you've done 8 years of school. 8 good years of school.
And then over the last, from January, it has just been Firimbi.
And at what point, right? Because, I mean, it's also not a short time. If you think about it, from July to January, that's a whole 6 months or so, right? You've been doing academic writing, farming, right? And then there's a call to action, right? At what point do that shift? Because it's not easy, as you say, the same way you were back in Homa Bay farming, and the Boda rider says, what's the use of a degree if you're going to go spend 8 years in school only to come back here and farm with the rest of us? We might as well, even our children, tell them to go immediately to farming, right? That's stigma. So in that frame of mind, I'd imagine even for you to say that I'm either going to take it, I'm going to go to the streets. It's not something that is easy. Right? It's not, again, the 8 years of school, you did not go with the intention of, at some point, I don't want to work, right? But at what point do you then take up arms and say, you know what, I'm not being heard? At what point do fellow unposted interns say, this is too much, right? Is it just a factor of what you've just undergone, but what is happening on the other end? Who are you talking to? Is it the union, right? So that you're saying, let's just go to the streets. What's happening at that point in time?
Okay, even before we went to the streets, there was a lot of mental breakdown. Like so many people in our WhatsApp group, we have a WhatsApp group for all the interns in the country. You could see the frustration. People are typing with a lot of bitterness, anger. And even some of my friends have called in confidence, telling me some are even considering suicide. So every day, maybe we have to organize some Google Meet, group therapy. We talk, encourage each other. And then, so we developed a liaison committee. And then the liaison committee has been working with KMPDU to talk to the Ministry of Health to advance our issues.
I hear you. I mean, it's a sad situation, really, because that mental anguish, right? Because it's, as you're saying, you had perhaps the lack of doing some farming, online writing. Not all of them had that opportunity. The familial pressure, I'd imagine, you got support from your siblings, you got support even from the government itself, right? Not everyone has that. Probably some people took out loans so that they could just make it through medical school. And it's not necessarily because they thought there was going to be immediate rewards. It's because they said, at least there's a path here where my country needs doctors. So at least we can contribute to this, right? Yeah. But going back to just the mental state, because I do want to paint a picture to people that it is not a factor that doctors at the end of the day can choose to wake up today and go to accounts, or can choose to wake up despite the 8 years to go to, since you are one of the top students in Kenya, you couldn't just wake up one day and go to any other course, right? You have done your 8 years. You need your practice license, right? Was there a discussion at a certain point of saying, maybe let's start off from here? Because you've described the fact that, yes, there's the liaison committee, there's KMPDU, they're having this conversation with the Ministry of Health, right? But was there any halfway point where they've said, okay, maybe let's take a few people in, has there been any sort of conversation around halfway points, compromise, for example?
Okay, the first promise they made, which really annoyed the interns, was that we are going to be posted in July. They gave some letter. The letter had no reference number. It had no stamp, and it was also not signed. So KMPDU invalidated the letter after meeting with the Ministry of Health. And then there was another promise, like yesterday they had a meeting with KMPDU and the talks failed. So the ministry tried to go behind the Kenya KMPDU and have a meeting with the liaison committee. So they had a meeting and they were promised that upon approval by the cabinet and treasury that we would get our posting letters maybe on Thursday. And they were given on condition that we will not join the strike. And, I think what I could say, it's an indicator that the government has panicked about the scheduled doctor strike to begin on Wednesday midnight. And they're trying everything to frustrate it. And maybe they're trying to exploit the desperation of interns, what we are going through.
Okay. Just to understand, so the Kenya Medical Practitioner and Dentist Union represents you in most of these meetings alongside the liaison committee, right? And so there was a scheduled meeting yesterday, I'm assuming with the Ministry of Health officials, Cabinet Secretary, so on and so forth, which the union had in the morning.
At 7.
At 7 a.m.
Yeah.
And
the
then
CS didn't attend it.
And the CS did not attend. However, in the afternoon or in the evening separately, the unposted interns, not the union necessarily, the unposted interns, the committee, the liaison committee, there was a separate meeting where the union was not informed, where the interns who have not been posted for all this period, who, yes, there is a level of desperation, for example, are called into a room. Essentially, the children are called without the parents and told that if you agree to the terms that you don't join the strike, you take certain terms. One of those terms I believe you had mentioned was 4 months of no pay.
Yeah, you don't complain about, or you don't plan any strike if you're not paid until July. So you'll be paid in lump sum in July. And just like the many other promises we have been given from last year, I don't expect anything.
Do you still want, if they posted you today, would you remain in this country to be a medical doctor? They post you, say at some point you're posted, right? You finish your internship, which is 1 year, I'm assuming, God willing, it's 1 year. You get your practice license. Would you still remain in Kenya?
The situation is unbearable. You just have to leave because now there are 4,000 unemployed doctors. So when we complete our internship, we'll only be increasing the number to 5,300 unemployed doctors. So if there's an opportunity outside, what do you have to do? You just have
take
to leave.
it.
Yeah.
And what happens to Homa Bay, the same place you come from? What happens?
You'd really like to give back, but the situation does not allow. So maybe you can start some projects, but at least you need some foundation. You can't give what you don't have. You can't rob a naked man.
You can't. And you're human after all. You're someone's child. All of us are. Because one of the points people always ask is, doctors, at least, there's a sense that we are special, right? But at the end of the day, you have, as you said, a family that at the end of the day will be looking out for you, right? Yeah. It's not that you can go years and years without pay and still manage to even give quality services, right?
It's hard going, I think which labor union would agree to not working for...
Not teachers, no one. No one.
Yeah.
No one.
Our result still remains the same. We want to be posted now and paid now. If the posting letters are ready, then this cabinet secretary does not need to call the liaison committee. She can communicate on her Twitter that come and pick the letters. It's not that hard.
It's not that hard. There's no need
don't need for another boardroom meeting or something. Just call us. Come pick the letters. And
you'll go to the Ministry of Health, pick your letters, and go and start working.
Yeah.
And that's it. Kigundu. How did we get here? How did we get to a situation where in a country where we're constantly crying that our health system is breaking down? We are constantly crying that we don't have doctors. How did we get here?
In the year 2001, just before the elections, where there was the Rainbow Coalition against Kanu.
That far back.
A lot of that's the time I did my internship. So 2000, 2001, 2002 period is a very instrumental period in the history of medicine in Kenya. And at that time, if you ask the doctors who are working then, including me, I think I was the last sort of group to bridge between it was not even poor pay. I don't know what you can call it, but
how much you
generally needed to work elsewhere to survive, so to speak. So the pay for doctors and medical workers was very bad. And that reflected in the health system. So there had been many industrial actions by doctors. There was the 1971 the Kenyatta National Hospital, where Dr. Aloch was one of the people who was arrested and thrown into Karen police station when doctors were arrested and thrown in for going on strike. Then I think it was around Kenyatta National Hospital. Every decade there was a strike except the decade of 2000 to 2010, where Kenya Medical Association actually did a proposal to the Ministry of Health that led to revolutionary sort of pay for the doctors and medical workers. And what was done was that during the campaign period, we were hosted by the then President Moi in Cabernet after doing many medical camps together with the NHIF around the country with many politicians like Kalonzo Musyoka and Ngilu in their areas. And the final one was at Cabernet, where the then chairman of Kenya Medical Association, Dr. James Nyikala, asked the president for a pay rise for doctors. And the technocrats then advised against because they thought the wage bill would be high for the country, so because doctors were part of the common civil service. And although their job and the health workers' job is a bit different. And therefore that was rejected, and President Moi told us he had offers from South Africa, Namibia and all.
To donate
and
doctors.
Whoever wanted a pay rise could actually come to him, and he would give us. I was a young boy seated next to him, and I was very shocked.
This is
a
President Moi.
In the year 2001, during the election, the late President Moi. But the Kenya Medical Association did not give up, so they did a paper that was passed to the Ministry of Health. And then we had a very capable Minister of Health called Professor Wangari. He was a pediatrician, and he facilitated this, because one of the biggest problems the doctors had was pay. Because you are classified as a general civil servant, yet there are some uniqueness. So when you ask about specialness of doctors, there are special features of a doctor, which include working late at night, reading for many years,
8 years
before you start, and just for the purposes of acquisition of knowledge. And I think a lot of times knowledge and acquisition of it has been looked down upon. But without knowledge, you cannot actually treat someone well. So what happened is that the Kenya Medical Association passed a proposal whereby health workers would get compensation within their civil service job group, but with additional allowances. That was the only way you could get a decent pay for that. So some of the allowances that were allocated to health workers, because they encounter
certain
situations that may be different from a civil servant within the same job group. So that included extraneous allowance, risk allowance. You see that, and especially that time was an era of HIV, which is still is. So doctors were at risk of HIV, accountants were not. So there is that justification, risk allowance. To some extent, for adding purposes, there was an allowance called a non-practice allowance. It was a good name because it is unique. It is there was so those allowances ended up, in general, the aim was to increase the pay of the doctor. So for the first time, a doctor in a job group had higher pay than probably other civil servants, by the fact that they were doing that work, which needed recognition. And that was a brilliant move, because from then on, the morale and health workforce became much better. In the era of the Kibaki era, 2002 to about 2013 there, the policy at the Ministry of Health was very progressive. It was aptly termed reversing the trends.
Reversing the trends. Okay.
The team that had entered there, and that time they had actually grabbed the chairman of KMA into the ministry, who was now, I think, the DMS. So the policies they put in there were brilliant. And the reversing the trend, they had done a study on the health sector, and so that the trends in the health sector were all negative. Health sector was a net expenditure to the exchequer. Health sector was poorly managed. There was no leadership, and so they crafted what is called a performance contract. And the performance contract was escalated all the way from the permanent secretary, Ministry of Health, all the way down to the community health worker.
Yes.
Believe it or not, those days we still had them. Huh?
Community health workers.
And it was clear.
It's not
it was clear, it was well defined.
Okay.
An important thing that they put is that at the helm of health leadership, they put the highest qualified person.
Okay.
For instance, a lot of times prior to that period, you would find, for instance, a medical officer heading an institution which has a consultant. That was changed.
Tricky.
So, I mean, a consultant, if a consultant is the highest person with authority, then he needed to be the head. And that's how I ended up being a medical superintendent in Isiolo District Hospital in 2007, because when I went there, I was the only consultant. And they made me the med sup. And
the boss.
when you have the first pillar of health system sorted, health governance, then you're sorted. So and they sorted it by putting the highest qualified person and had a written performance contract.
Yes.
And
how did the revenues do there?
So what happened as a result of that policy, and probably a study needs to be done on that, the health sector turned around. And it turned around so much so that from being a net expenditure item at Treasury, it was actually contributing to Treasury. So that by the time I left, for instance, being a medical superintendent just before a devolution, health was, the monies in health were actually contributing to the economies.
Are you serious?
Yeah. So and probably that's the reason the governors
when devolution
happened, and it was actually devolved well by the president. But in between there, they went and looked at the areas and saw that the hospitals were centers of revenue, and now forced the then president Uhuru Kenyatta to literally unconstitutionally devolve health, and that was a subject of 3 court cases, and we know how that goes.
Yeah.
Back then, now that said, if you now go back to the aspect where it was recognized that there are some aspects in health that are different from others, hence the basis of a health service commission.
In fact, I was coming to that because most people say that if you look at Teachers Service Commission is able to coordinate really matters, teachers, education, right? In health, we seem to have many bodies. We have Kenya Medical Association. We have the union you can understand. We have the medical board, and people are never quite clear. Then there's the Ministry of Health. Then when you go to counties, there's County Executive for Health, where people are always, what's happening in healthcare? Is there no one central body that you can say, if it's matters posting interns, this is the body. If it's matters even counties, this is the body, right? Why no health service commission?
So the union was, due to the new constitution, we were allowed eventually to have a union in 2010.
Wait, there's no union before 2010?
Yeah.
So before 2010, they attempted to form a union in 1996 called KMPDU. And it called a strike that has never ended. Even the strike callers have died. There is Dr. Givens Ateka, who had to run away to South Africa because then the terror that was rained upon them in 1996.
Yes.
A lot of them ran away and went to South Africa.
Okay.
And it was unconstitutional then. They were saying that they were calling them services that are not unionizable. But 2010 allowed everyone to be able, and that's how the union was formed. Prior to that, KMA was acting as both the union and the professional associations. So in terms of human resource, KMA was very happy when the union appeared, because now they could handle the matters, human resource issues. So a health service commission per se would mainly be a human resource organizing unit.
Yes.
Prior to devolution, there's the Public Service Commission. And the PSC did quite a good job. I mean, and it promoted some of the values that we want as a country, which include patriotism, reducing nepotism and tribalism, by you being able to, you can be posted anywhere as opposed to the current situation, so to speak. So the Public Service Commission was doing its job. When I finished internship, I was posted to Machakos.
Yes.
I was actually posted to Machakos as an intern, then posted. When I finished, I came back to school. Public Service Commission posted me back to Kenyatta.
Yes.
When I finished, I was posted by Public Service Commission to Isiolo. That helps. It helps us learn a lot of the cultures around, and it helps. So these are some of the values we want to espouse. But as I said earlier, as you saw, those unique items which even could be added to a proposal by KMA, including risk allowance, shows that the health space is different and therefore needed to be run by a commission like a teachers service commission. And hence these problems that we are having with interns would probably not have been happening because the health service commission would have budgeted for interns. So now we are waiting for a ministry to budget for interns, and they are not budgeting for them, or if they are not having the force of law to go to treasury and get the money. So I think at the end of the day, our push and call for a health service commission gets justified in these situations where we are having interns having to stay out and not go for internship.
I mean, it's an interesting sort of dynamic, because then on one hand, you have the national government responsible for interns, right? Then you have the county responsible for now post-internship when you've become a medical officer who wants to perhaps specialize, you're under county, right? So there's shifting responsibility between national and county. And that's why I'm assuming currently you're not hearing so much from the Council of Governors, because then internship in itself is a factor of national government. That's why now it's Ministry of Health, CS and whatnot, right? But fundamentally, students are coming into medical school, they're graduating every year. So a budget should be there regardless of year or whether it's national or county, right?
Actually,
yeah.
When we report in first year, there's something called indexing for all medical doctors, dentists, and pharmacists. Like the KMPDC has your data, and it is updated every year, and that is for foreign trained doctors and the local ones.
Yes.
So the ministry is not surprised. It should not
It's
claim
not
to
an
be
acute
surprised
event.
that
They graduated. Oh my God.
medical interns.
Yeah.
They have the data.
Yes.
So when they were making the budget last year, this should have been projected.
It should have, because, and that's why it's surprising to hear there's no money. That means potentially the budget line was, what do you call it? I want to say rubbed off, scrapped off, or it was it wasn't given priority, right? Competing priorities, we understand under the Ministry of Health, there are competing priorities. We're rolling out universal health coverage. We're doing all these wonderful things, but then there's no priority, and that's what I was heading towards. That fundamentally, because this is even a conversation, even before we talk about policy, it's a conversation I've had with friends, not doctors, but with friends who have asked again and again, us as they did, let's just say another course that's not medicine. And so they say, when I finished school, I had to tarmac, right? I walked around with what they called the brown envelope, going door to door, asking for a job. This is not a unique phenomenon to Kenya, right? And so when I speak to my friends, they say, why should doctors be special? They ask that. But more importantly, what they say is that at the end of the day, right, doctors get potentially with 1 week off. Is that the
medical internship should run for 13 months.
Yes.
That is 12 months of active practice. And then the last month is, they call it paid leave, but Minister of Health has never honored it. So ideally we work for 12 months running without any break. And then it also depends on the center you are in. There are centers that have very few consultants and medical officers. Or
they don't have accommodation that's close by? Have to find someone who's going to house you at least. Might be. And that's in the
training. and doctors, and that is similar to actually what has
Has
almost
happened in
happened in
Kenya.
Kenya, whereby you have students without some form of, where the medical board is actually removed from actually being sort of the supervisor and advisor for the same. So the strike in South Korea is very interesting, and it is can be directly related to what is happening in Kenya now.
In fact, that's such a good point, because again, in these conversations that we have, someone did ask that at the end of the day, if you have now 5-6 medical schools in Kenya, each of them accepting 500 plus, say, or whatever average number between 200, 500, right? Have we also, at the end of this funnel, looked at it and said, oh, the output of the students who are going into medical school, can we accommodate them? And what you're saying is that technically, since the board is no longer involved in the process, universities are able to say that we're going to take not 200, we're going to take 500 plus. In fact, because medical school, you'd go, say, September to June, right? Continuously. It's not where you get long extended breaks. So now there's an introduction of, I can even do double intake. So I took the first intake of, say, 400, 500. Then I'll take another intake, because I think it's in your cohort in particular, at some point you had 2 intakes, right? Or you still have 2 intakes.
Okay, it's still there, but they're trying to match it through some long holiday, like when you're done with third year, so you have to go stay home for close to a year as the other lot proceeds.
So then this focus on numbers is that it's at the expense of quality, because you spend 1 year at home, right? And again, medicine is not, again, it's about the knowledge, it's about practice, right? So you spend 1 year, you're coming back to school to then almost not start again, but remind yourself, right? Which is not the case, where when you're graduating, you don't want students to spend 1 year additional to the 1 year that they're going to spend, because you as a health student, right, you have to actually you waited 1 year to join uni. And then, okay, no, you don't have to wait another 1 year. By help, actually, that's such a good point. As a government sponsored, you have to pay back the money, isn't
you
it?
Have to pay.
When do you pay back the money? You are sponsored for now 8 years of medical school. When do you start repaying the money?
You have a grace period of 1 year post-graduation. And then after that, there's a monthly fine if you're not paying any amount. So you're almost running to the end of the 1 year post-school.
So you'll not have, if you have not been posted by July, you not only owe the government a principal amount which they sponsored your education, there's an interest of 5,000 every single month that will accrue, yet they have not posted you, if that would be the case.
Yeah. They want to drive you into poverty and completely.
That's true.
Do you feel there's a plot here?
It's true.
Yeah.
Actually, if we are to do what are those things called? We call them conspiracy theories.
Yes.
Then that can fall nicely. When I completed internship, I had medical school. I actually had a loan from the Higher Education Loans Board that I took about 7 years to pay. And you pay back when you're working. And ours had some interest rate. So, it's calculated, and then eventually you get a certificate. I have a certificate of having paid. And therefore, the situation here is even worse now because according to the CBA, for instance, and rules of natural justice, interns are supposed to be posted within 30 days of completing medical school. And once they complete that, then after they finish their internship, they are licensed to actually practice on their own.
Yes.
During internship, they're actually licensed. They have a license, but to work under supervision. So it's called temporary license. Then after that, then you can become a useful member of the society by looking for work and paying. Times have changed where a long time ago, people, doctors, and to answer your special questions friend. Doctors used to be employed directly. Immediately after internship, you are deployed because there is need. They still need now. It's only that they are not employed directly. And there is all these issues of waiting for adverts from counties, private hospitals and all. But now you need to start paying back a loan. And I think someone should actually go to a constitutional court and challenge the fine that Dr. is talking about, whereby you're expected to start paying back, yet some of the things that the government should have done, they have not done, including enabling you to practice as a doctor by funding your internship. For at the end of the day, the one thing that should never not be paid is internship. And for these two things, and as you put it, are you saying doctors are special? There's something called a profession. There's a job and there's a profession. A profession is guided by laws, and there are rules and regulations that you should abide by, for the fact that it has a lot of implications, and is guided by code of conduct. A few professions are guided by a code of conduct, and there are penalties for breaching code of conduct. And therefore, when you think of it as a profession, then that and in medicine, it's continuous improvement. To this day, I keep reading and learning more, listening to others. And therefore, medicine is not just a job. You did not just get it. You need to continue learning, continue reading, so that you are able to provide the best care to the people you treat. And you asked a very good question. The person who is asking you a question should let them think of themselves as the patient.
As the patient.
Who do you want to treat you?
Absolutely.
Because health is wealth. If you are ill and you are treated badly, let's say, then it'll impact on you. And these are important issues that we should continue discussing, especially in the light of this internship fiasco, so to speak. Think of yourself when you're being treated by this doctor. What kind of doctor do you want to be treating you?
Absolutely. That's what it boils down to. It's not about your doctors are special. It's not that they were the best brains. It's not that. Because sometimes you almost feel like, and this I've had, that the public is not on our side, right? Sometimes you get that sense. And it's because maybe people say doctors are entitled, that this, that. But that's not it. That's not the focus. It's at some point, whether we like it or not, you might get ill. It's not something that you can predict, you can control. So if you get ill, what kind of doctor do you want to be seeing you at the end of that, right? What kind of doctor do you want to meet you, right? Because is it a doctor who, one, has spent 8-10 years just to get their practice license, right? In between their 9 months, 6 months, 1 year, not in school, not practicing, right? And we know that the more practice you have, the better a doctor you become, right? But is this the kind of doctor you want to meet? A doctor who fundamentally probably has not been paid for 6 months, has children. A doctor who, for example, as you have seen, has their own child who's sick, cannot afford, as the doctor, to pay for their own medical cover. A doctor who, for example, has a spouse who has passed on, could not afford to bury the spouse. Is this the doctor you want to meet when you're at the hospital? Because it's not a matter of, I will never be sick. You will be sick. Someone you know, someone you care about will be sick at some point. Who's the doctor you want to meet when you go to the hospital? Think about it. Think about it. And when Joseph, his colleagues, and other doctors go on strike this week, the question should not be, why are doctors going on strike again? The question should not be, doctors already earn millions. That should not be the question. The question should be, what kind of doctor do I want treating me? Thank you for joining us on the One Health podcast. Join us next time.
Hello, my name is Dr. Soy Silvata. I'm a medical doctor and an entrepreneur. I work at JKUAT Hospital. So my work normally involves seeing the staff and the students of the university. And typically I'll get to work at around 7:30 and see patients in the ward. So we have a ward for pediatric patients, female patients and male patients. And then after the ward round, mainly we do outpatient. So seeing patients who come in and go for, who are not going to be admitted. And usually we also receive emergencies. So our bulk is outpatients and emergencies. And I personally prefer doing the emergency cases because they keep me on my feet and they keep me active, and it's not like sitting back behind a desk and just passively listening or actively listening. And typically I finish my day at around 6:30 p.m. and then at that point I have to attend to my business. So I run a car wash at Rosters behind QuickMart, and so at the end of the day I'll just go look at the books, check if everything is adding up, and that's how I end my day.